Good evening viewers, welcome to our Awareness program. Tonight we have Master Daniel from Philippines. Good evening Master.
Good evening to everybody.
Master would like to know what is Pranic healing.
Pranic healing is an alternative healing modality. It's called alternative because it's not your usual traditional form of healing people, which is what you normally get when you go to a hospital. What makes it alternative is that Pranic healing uses energy or life force. In the Indian tradition, this energy is called prana. So in Pranic healing, you use prana to heal people. This prana, because it contains life energy, the moment it is in the body of a patient or somebody who is suffering from an ailment, this prana is used by the body of the patient to heal itself. And if you have more prana in the body of a patient, the patient will heal faster than if the patient has less prana. So in Pranic healing, the main course is taught in 2 days. In 2 days, a person would learn how to do this. Of course, we're very careful to inform all the students that Pranic healing is never intended to replace modern medicine. So let's say if a patient requires surgery, they have to be brought to a doctor. If a patient, let's say, requires a tooth to be removed, they have to be brought to a dentist. We don't advise the students to be, very fanatical about Pranic healing. We always tell them to be practical. However, Pranic healing can be added to whatever treatment the medical doctor gives, because Pranic healing heals the energy of the patient, while the medical doctor heals the physical body of the patient. So these two are compatible. This technique has been developed by Master Chowa Kok Sui. So he has written many books on Pranic healing. And there are many levels of Pranic healing also. The main course that's taught, which is 2 days, is the Master Chowa Kok Sui Pranic healing course.
How do we get pranas?
Oh, receiving prana is easy. There are many ways of doing this. Now, unconsciously, you are actually receiving prana every single moment. When you walk, let's say on the beach, the soles of your feet absorb the ground prana from the sand. When you are walking through the forest, your body, your aura, your chakras absorb air and tree prana from the trees. Unconsciously, everything happens unconsciously. It's like when you breathe, if you're not aware of your breathing, you're taking in air automatically. Your subconscious just does everything for you. Now, this is different from consciously absorbing prana. Subconscious absorbing prana, it's like automatic. Your chakras do it, your aura does it, even without being told. But when you consciously absorb prana, this enables you to absorb greater quantities of prana. It's like breathing. When you consciously breathe and you absorb more air, you take more energy into your system. So same with prana, you can consciously draw into your system more prana, either by practicing certain pranic breathing techniques, which are similar to yoga breathing techniques. So through breathing, you can absorb prana. And number 2, through intention. Just through intention, because the prana is so soft and subtle, more subtle than smoke. It is so subtle that whenever you think, that prana, that energy, can follow your thought. So if you think of the center of your palm and you say, I am absorbing prana, automatically more prana goes in to that particular hand. This is with consciousness, with your own focus present. Because if you just hold your hand subconsciously or unconsciously like this, it doesn't absorb as much prana as when you do it consciously.
How does Pranic healing work?
There are 2 main principles that are behind most healing modalities. The first is the body is intelligent enough to heal itself. So normally we have ailments, minor ailments, and even if you don't take any medicine, they go away, they disappear. You may have a fever, you may have an infection. If it's minor, even without medication, the body can heal itself, and within a few days you're okay. This means the body is intelligent enough to heal itself. That's the first principle. The second principle is the principle of life force. In Pranic healing, we clean the aura and the chakras. That is the preliminary step before you can put in the fresh prana. So cleaning the aura and the chakras is done by using the hands to sweep the dirty energy away. So this is one way of sweeping. There are many ways of doing cleansing or sweeping. So in the pranic healing courses, one technique that is taught that will help clean the whole aura is to use two hands. So you can sweep the entire aura using two hands. Now as you sweep, your fingers and your hands will gather the dirty energy. You pull it out of the aura of the patient and you throw that dirty energy into this basin, which is water with salt. The water absorbs the dirty energy and the salt breaks it down. After you do the general sweeping or sweeping for the entire aura, you proceed to clean the individual chakras. Now this is called localized sweeping. So you can clean the crown chakra using one hand. Again, you grab the dirty energy and you throw it into the water and salt. The hand has to be fairly close to the physical body, but it should not touch the physical body of the patient. Now it is clean, you can put in fresh prana, and you put in fresh prana by using one hand to absorb the prana from the sun there in the ground, and with the other hand you transfer the prana to the affected part. The process happens automatically. The moment you open one hand, prana comes in. The moment you hold one hand with the palm facing outward, prana goes out of this hand and into the patient. And you hold your hand in that position for approximately about 10 breathing cycles. You inhale and you exhale. That is one cycle. Inhale and exhale, 2 cycles, up to 10. When you're finished with the 10 breathing cycles, you repeat the process one more time. That means you sweep this area again 30 times. Sweep it again 30 times. And then when you're finished with the 30 sweeping motions, you repeat energizing the same area with 10 breathing cycles. Receive prana first, then give prana. The next step is to ensure that the prana, the energy you have given to this area, will not leak off, because there's a tendency for the energy to slowly dissipate. Now, to keep the energy in this area, in pranic healing there's a technique called stabilizing. When you stabilize the area, the energy in this area, the energy stays put and does not leak. So it remains there where it is needed until it produces the desired result. The last technique in pranic healing is called releasing. Now, what does this mean? This means that during the healing process, an energy link has been established between the healer and the patient. So this energy link is in the form of an energy cord. So once the healing is finished, the healer has to release this cord, has to cut it, so that now the patient can continue the healing on their own, and at the same time the healer is free to do another patient. For simple ailments, pranic healing can heal them easily. I have seen it many times. I have used it on myself many times. For example, you go to a place, you eat something that doesn't agree with you, your stomach starts to disagree with you. So you just do pranic healing and the stomach subsides, the ailment disappears. How come it's not 100% of the time? Because nobody can give that guarantee. No? If you can heal everything 100% of the time, then you're God. and we are not. We're just ordinary human beings. Now, for the more severe ailments, cancer, leukemia, severe arthritis, for example, in these cases, pranic healing is about as effective as other healing modalities. Pranic healing, there's no guarantee that it will really be healed. Because if the disease is at such an advanced stage, the situation is in God's hands. But what can pranic healing do? What pranic healing can do in these cases is, at least it can minimize the discomfort of the patient. If there is pain, the pain can be reduced. If there is worry and anxiety, the worry and anxiety can be reduced. So that the person, even if they are suffering from a severe ailment, at least they can continue to live with a certain degree of dignity. They're not at the mercy of the pain or the anxiety or the worry. Since it is compatible with medical treatment from medical doctors, you can use this for all ailments without any contraindication, without any conflict. It is perfectly compatible. And in fact, if you have medical treatment plus pranic healing, the two combined increase the chances of the patient healing faster or healing better. Now, of course, there will be some patients, some ailments that pranic healing cannot heal or will have difficulty healing. And I have personally also encountered many cases like this. For example, we have treated patients who have been paralyzed from the neck down, either because of an accident or because of some unknown disease. And no matter how much pranic healing we do, the patient does not improve. And of course, in my younger years, I took this as a personal challenge. I said, how come this patient does not get healed? So I would force myself to actually do everything I can possible to heal the patient. But still no result. And finally, I heard Master Choa say, you cannot heal everything. If you were able to heal everything, you would be God. If the patient heals, that is because God allows it. If the patient does not heal, maybe God thinks it will happen later. How long does it take for a person to get healed? Now, if it's a simple minor case, like a headache or a stomachache, in one session, 15 to 20 minutes, 30 minutes tops, a person will feel relieved of the ailment. Now, if it's a severe ailment, for example, if it's arthritis, for example, if it's emphysema or asthma, for these particular cases, a patient needs to have maybe 2 weeks of continuous pranic healing. Now, each week, the patient can receive maybe 3 to 4 sessions of pranic healing, each session lasting maybe 30 minutes to 1 hour. Now, how come it takes a longer time for the more severe ailments? It's like this. The physical body needs prana to heal the ailment, but the prana cannot be given in one dose. Just like medicine, you don't take all the pills in one bottle in one shot. You take it one tablet at a time over a period of several days. Same with prana. The prana has to come into your system a little at a time. You can't be given the full dose of prana, otherwise you drown. Just like you can't drink 5 gallons of water in one sitting. So for the severe ailments, you need to apportion the prana a little at a time over a period of maybe 2 weeks. In 2 weeks, there should be some positive result, whether there's 10% improvement or 20% improvement in the condition of the patient. Several times. In some cases, it's 50%. In some cases, it's 100%. It's different from person to person because every case is unique. So some patients, their bodies are younger, they heal faster. Some patients, their bodies are older, it may take more than 2 weeks. Some patients, the ailment is not that severe, maybe in 1 or 2 sessions, they're okay. Some patients, the ailment is a little bit more severe, so sometimes 2 weeks is not enough. We've had cases where, let's say in the case of drug addiction, the treatment can last up to 6 months or more because it takes a long time to heal these particular cases, especially since the mind of the patient is involved.
What are the effects of pranic healing on children with learning disabilities or those with Down syndrome or either with autism?
Pranic healing cannot heal everything. So for example, cases of Down syndrome, the child, you can apply pranic healing on the child suffering from Down syndrome to a point, and the child can improve but not be healed completely.
Okay.
Improvement may come in the form, let's say, of after treatment, now they can maintain eye contact with the parents.
Yes.
Or now they can respond to instructions from the parents. Look at me, okay, put the spoon in your mouth, or some other case like where that would be a visible sign of improvement in the behavior of the child. Now, in cases of, let's say, autism, we've had some degree of success with autism using some other methods. For example, Master Choa has come up with a new revolutionary method called super brain yoga, where the benefit, the results of the super brain yoga manifest in the increased intelligence of the child. And they have tried this for autistic children, and they have improved to a point where they are manageable, because usually some of them are not manageable. You call them, they don't listen to you, they go and do something, they don't take instructions. But after pranic healing, after superbrain yoga, in most cases, they now respond. They have eye contact, they respond to the people in front of them, they listen, they obey the instructions of their teachers and their parents. So to some extent, that is already an improvement. But there's been no 100% cure where the autism has been 100% removed and now the child is considered normal. However, there have been cases where a child who is not autistic but who is, let's say, below average in academic performance, after pranic healing, after superbrain yoga, the child has become so intelligent that instead of being classified in the classroom for the less smart children, this child has become so smart, he is classified as gifted.
Yes.
So in these cases, you can say, okay, maybe pranic healing, master choice technique, superbrain yoga will really worked. But the reverse, let's say someone who was autistic to become normal, I haven't seen yet. Though some have become almost normal, which for parents I think is good enough.
Yes, that's a good step. Master Daniel, you mentioned earlier that pranic healing needs a teamwork, means you need the cooperation of the patient. But what if someone is in an unconscious state or is in a coma?
Pranic healing can be applied on someone who is sleeping or on someone who is unconscious or in a coma. Now, the cooperation required from the patient is that they are willing to allow the healing to take place. So if they are asleep, then obviously they are willing.
Yeah.
Because the conscious mind does not come into the picture and reject the energy. So if a person is asleep, it's a good time to do healing for them. They are receptive when they're sleeping. If a person is unconscious, then obviously their willpower is not there at all to reject the energy. You can do pranic healing. And I have seen and I have heard of cases where a person, for example, has been comatose or has been unconscious. They did pranic healing on the person and they woke up. So in one case, this is a documented medical case in the Philippines, there was a patient who did not wake up after surgery. You know, when they have surgery, they put the anesthesia and they fall asleep. Now, the anesthesia is given in a right dose so that the person will wake up. But apparently, after the operation, the patient did not wake up. So officially, the patient is not comatose. The condition is patient did not wake up. No? So the surgeon was worried and called the medical director or the assistant medical director, someone in the hospital who knew pranic healing. So the person who knew pranic healing, he was called. He said, okay, let me go and see the patient. So he went. He did pranic healing on the patient. He did everything. Still the patient did not wake up. So he tried acupuncture because this medical doctor knows many healing modalities. He put the needles, still patient did not wake up. So he said, okay, he was feeling the energy of the patient. In pranic healing it's called scanning. He said the energy is being absorbed by the patient, so maybe it's just a matter of time. You see, in pranic healing we call it lag time, principle of lag time. The energy body and the chakras may have healed, but the physical body is lagging behind. So it may take a few minutes before the patient's body absorbs the healing energy and starts to heal itself. So the doctor, after doing pranic healing, he said, okay, I think it's just a matter of time. Because pranic healer has done his job. So he removed the needles. As he was about to walk away, the patient's leg twitched and moved. Then one hand moved. Then pretty soon the patient woke up in a sudden, fully awake. Normally, when a person is under anesthesia, when they wake up, there's a period where they're feeling groggy.
Yes.
But this one, the patient woke up fully awake. And what happened? They said, operation is finished. Okay. The patient went back, lay back down, and they were able to bring the patient to the recovery room.
Master Daniel, to conclude, do you have any message for our viewers?
First of all, I'd like to congratulate the people living in Mauritius. You have a very beautiful country, a very beautiful island to live in. You have lots of fresh prana from the sun, the air, and the ground. And with pranic healing, you can heal most ailments more easily, and pranic healing can also help you maybe discover your spiritual side.
Master Daniel, thank you very much, and I hope you have a wonderful stay in Mauritius.
Thank you.
Thank you, viewers.
We have regular sessions of courses of pranic healing in Mauritius, and we also do invite masters from abroad, as you would have already interviewed Master Daniel, and there is one more master from India who comes here, Master Shiram.
Yes.
So apart from conducting courses here, we also do invite more experienced teachers for the benefit of the people here. And as regards to the other activities of the institution, we do have free healing sessions for the people who are in need of additional support. The policy of the foundation is teach people the fishing rather than give the fish in their hand. So our prime policy is to help people to learn this simple technique so that not only they help themselves, they can help the members of their family also. So the most important activities of the foundation are: number one, teaching people the courses; number two, helping them with additional supportive healing; and number three, which is also a very important activity, that we have got meditations. So many people come and participate in the meditations, and they upgrade the quality of their spiritual life. Most importantly, the pranic healing can be learned by anybody without any background whatsoever. One doesn't have to understand anything about healing or meditation. So a person who wants to learn about pranic healing, they begin with what we call the basic pranic healing course. From there we come to the advanced pranic healing course, which basically uses certain special colors for the healing process. Then we come to what is called pranic psychotherapy, which is primarily focused on emotional balancing. These are the three levels of the pranic healing as regards the healing is concerned. Then there is a spiritual side of pranic healing, which begins from the Arahatic Yoga. The word Arahat means enlightened being. So Arahatic Yoga is one of the most wonderful aspects of pranic healing, where people can upgrade their quality of life from the spiritual point of view. Just to give you an example, as per the experience of people, they find that their spiritual path can be accelerated at least 100 times by practicing these simple Arahatic Yoga meditations.
I came to pranic healing through the counseling of one of my teachers. Being the chairman of an international school in the north, she was very friendly with my wife, who suffered from a very serious condition, which is an herniated disc in her vertebral column. The situation is very, very painful. Definitely she was under a lot of medication, but at night the pain increases incredibly, and it is very, very painful. She cannot sleep, and I don't sleep also. So I went to take the course with one of the instructors that was in Mauritius in the north. And I would say thank you very much to God, because after taking the course, it helps a lot to bring down her pain, because when she took her medication, it reduces the pain, but not as much when I do the sweeping on her. And this has helped her tremendously. And pranic healing has helped me a lot to discover my spiritual side. I am an optometrist, so from a medical background. But one thing which my teacher taught me is that you have to have an open mind, intellectual mind, inquisitive mind, not a parrot mind. Well, saying the opportunity, I would say try pranic healing with an open mind, so that you can start to think and apply it in your everyday life.
Normalement, ça fait bientôt 1 an que je pratique advanced meditation de pranic healing. Normalement, avant, ce qui me rappelle, comme je travaille, je ne suis pas capable de maintenir mon workload, j'ai toute bonne pression avec l'environnement en dehors. Je suis assez stressé, je suis frustré, je ne suis pas capable de maintenir moi-même comme besoin. Aussitôt que je apprends advanced meditation de pranic healing, ce qui m'a trouvé, il arrive une transformation dans moi-même. Maintenant, je suis capable de plus gérer la pression. Et je suis capable de travailler beaucoup plus bien, et aussi je suis capable de faire plus de travail, avec même les temps que je me tiens. Et aussi, message que je voudrais dire aux jeunes, c'est d'être capable de nous sentir ici. Surtout que ici, maintenant, l'environnement bien turbulent en dehors, on est capable de venir ici, on pratique une méditation, ce qui nous fait. Et ça m'a méditation là qu'à Jusrut. Merci.